Good morning, good morning, everyone. This is DG Diane, and I'm introducing Alan Turner from the Rancho Bernardo Club, and he's here to talk to us about mental health. Take it away, Alan.
Okay, thank you very much, Diane. And today we're going to be discussing a very complex subject of mental health. I think everyone has seen all the news about how bad things are, but what I really want to focus on is how can we as Rotarians help? Um, the situation is not good at the moment, especially for our youngsters, our adolescents. And unfortunately, suicide is the second leading cause of death in kids as young as 10 years old. It's so sad. And the other problem is that even after a child is identified and assessed as having a need, trying to get treatment for them is very difficult. Um, so this is a very significant problem that we are seeing, and it only was made worse during the pandemic, but even post-pandemic, it's very bad. So, I'm an engineer. What can I do? What can I do as a Rotarian? I'm not a medical professional, so how on earth can I help in this area? Well, the key thing here is we are members of Rotary, as Rotary clubs, Rotaract clubs, Interact clubs, and we are people of action. And you will have seen last year that Gordon McInally, our Rotary International president, made mental health his primary theme. And Stephanie Urchek, the current Rotary International president, has also picked up the mantle, picked up and continued to encourage Rotarians to help out in this area. And one of the ways that we can help is what is we're calling is to break the stigma associated with mental health. Mental health is very difficult to talk about. People think I better not talk about it. But we want to encourage awareness and to break the stigma associated with mental health issues. And sometimes we may see it also called behavioral health. Now, in our district, we have formed a chapter of the Rotary Action Group on mental health initiatives. So we have a very active chapter, and I'm going to talk a little bit about that and what we can do here within our San Diego and Imperial County district of District 5340. So earlier this year, we had a very successful uh, participation and support for NAMI. NAMI at their walk. NAMI is the National Alliance of Mental Illness, and each year they hold a walk, and we, as our Rotarians and family and friends, we we had a lovely walking team down at Liberty Station. Our team was over 60 people strong, and we raised over $18,000 to support mental health and behavioral health programs within San Diego County. And you may remember that this year the district conference was a cruise, and even the cruise participants on that same day arranged a walk on the cruise ship. Well, it was great to see how everyone got involved in support of this. Now, I would ask you to save the date for next year, for April 26th. Um, and again, we're going to be supporting the NAMI Walk. It happens to coincide with our Rotarians at Work weekend. Why don't you make this a project, one of your Club Rotarian at Work Day projects? Um, this is a great way to get involved, and we actually also help out on volunteering, on the setup, the organization, and the tear down of the event. So, so what else can we do? Uh, as I mentioned in my introduction, suicide is unfortunately, of a manifestation of someone who's had the ultimate of having not of having significant mental health issues. So what we're doing as a Rotary team is we're organizing training for suicide prevention. And this training is called QPR. So just as CPR is for helping you to be able to recognize a situation with someone with a heart attack and be able to do something immediately to help until the medical professionals arrive. QPR is for the mind. Stands for question, persuade, and refer, and it helps you to recognize the suicide warning signs. How are you going to respond if you hear someone talk and how are you going to recognize this? And then do I say something or do I leave it to the professionals? And the bottom line is yes, you do say something. And this training class helps you to understand how to provide the help and the hope for that person. We had one session last week in Carlsbad, and next week we're going to be in this week, I mean, tomorrow at San Diego North Rec Center in the evening, and then in Rancho Bernardo on Wednesday, and at 1 o'clock. So you've seen the emails and the news bits, so please sign up for this, and it's free. We're doing this in collaboration with San Diego County Behavioral Health Services Unit, and it's just about an hour and 15 minutes. So anyone can come along. You'd be very welcome. Bring your family, friends, and work colleagues. I want to give an example of a project that my own club, Rancho Bernardo Rotary Club, did. We worked with a team of counselors who created an organization called Parenting EQ. And what Parenting EQ does is it creates a kit of books, of games, and these are kits which can be used by families, especially once the child has been identified as needing some behavioral health help. This is a way for the family to engage in a conversation with that child because they don't know, it's a very difficult subject to talk about, and these kits are there to help. The kits have been so popular that school counselors are also using them. And so the games and the games have been put into a special kit just for the counselors, and our club purchased a set of kits for the councillors in the Poway Unified School District and distributed them to the elementary schools initially. And then since then, we've expanded in the second year to do more of the councillors, as well as some of the special ed assistants and teachers. So this has been very good partnership, and we've had some excellent testimonials coming back from the councillors in Poway School District about the use of these kits. I mean, they're also being provided from Carlsbad High Noon Rotary Club to some of the middle schools in their area. So I encourage clubs to think about how they might partner with Parenting EQ to distribute these kits either to youth clubs or family gatherings of families to help help these conversations, help these treatments. So coming back to who we are as a local action group for our district, we have a nice team of we have about nine members on our committee. I will encourage you as Rotarians to sign up to be on our mailing list. And one of the projects we did last year um, and 2 years ago was with our dear departed friend Chuck. And he is with myself and in support of an organization called Vista Hill. Vista Hill is one of the leading practitioners within our community of San Diego, and they have some excellent treatment programs. And with Chuck's sponsorship, we raised over $22,000 as a district grant amongst about 8 different Rotary clubs in our district to support Vista Hill. Now, this year, or each year, Vista Hill has a, a council on mental health to raise awareness, but also as a fundraiser. And this year, they are recognizing the work done by Chuck and then Chuck is going to be posthumously recognized as an advocate for mental health in our area. And Christine Carter is going to be the speaker at that event. She is an excellent speaker, getting great credits for her talks on TED Talks and others. So this is open. So I would encourage your club to think about putting a table together, and we'll send out an email with more details for you about this and coming up. So save the date for Wednesday, November the 13th, for the Council on Mental Health with Vista Hill, an excellent speaking program. So our chapter is part of a global network of district chapters, and they're very strong in places like India, uh, yes, throughout the United States, even Africa as well. And that particular action group has created a series of toolkits. For example, the one in the upper left, the lever, is aimed at training pediatricians on how to assess children. Because one of the biggest problems we have in this area is the lack of professionals, lack of skill to assess children. So the idea is to train the pediatricians to be able to recognize and even to do some treatment for those mild to moderate cases. Wellness in the Box is a toolkit that can be used for educating school children, teachers, counselors, and parents on the conversations around mental and behavioral health and how to talk about it, how to recognize and how to help get the people the help they need. And I just draw your attention to the bottom right, resilience as a component of RILA. The professionals within our action group have created a series of a presentation that can be used during a RILA camp for getting the camp members to talk about and understand themselves and how to build resilience. So this is something, and this is being presented as a candidate for our own Ryler in Idlewild. So with that, I would invite you to consider to sign up for our emailing list throughout our district. So just send me an email and I'll add you to that. We have this the QPR training, as you've seen it in our news bits and the code to register for that. And think about tools like the promoting parenting EQ to counselors and groups, youth and family groups within your community. So with that, I'll say thank you very much for your attention, and I'll be happy to. Please don't hesitate to contact me if you have any questions. Thank you very
Ellen,
much.
Ellen, excellent presentation. I just learned a whole bunch more than I thought I knew. Listen, I have a couple questions that I think the clubs will have. First of all, when it comes to the kits, do you also train the teachers on how to use the kits, or are they on their own to figure that out?
Okay, there's 2 types of kits. One is suitable for the family, the parents to use with their child directly. And the second one is for professional counselors to use because those counselors typically got all the books that they need on the subject. So they don't need a lot of the material, some of the materials, but they enjoy the kits, they enjoy the games and for engaging with the children. And they are designed to be self-learning. They're very easy to learn, and there's some training materials even within the kit to teach the
Mm.
parents and the counselors on how to use them.
And how much do these kits cost, just approximately?
For the families, they are $60 per kit and there's 12 different ones. And so that they can be used. But so, for example, interestingly, the parenting EQ has been selling them to homeschooling parents.
Right.
They've been selling them to charter schools. And so, but then the counselor kits, which are for the two sets of kits, are $250. Um, and our club raised money for those kits for the Poway School District, for example.
Right. I I can see a lot of clubs wanting more information about this, especially in my club. We were just talking about this issue the other day, and how we could help the teachers to recognize the signs for children in distress.
Yes, and yes, and so what we're finding is the school districts now are getting this counselors are getting better training on how to identify a child in need. But the problem then is finding the care that that child needs is very difficult. So what I like
Yeah.
about this is this provides that bridge, that a helping hand during those difficult times when the parents don't know what to do and they're needing some help. So I think this is an excellent way to give that family some hope and some help, as well as providing tools to the counselors to engage small school groups on a very difficult subject.
Now we've talked about the school groups, the small kids, the elementaries. What about in the college level kids, the older ones?
Yes, this particular set of tools is not directed at that age group. As
Right.
it happens, there's another program. One of the members of the Rotary Action Group is from Wesleyan University in North Carolina, and they created a self-help journal, which can be used, um, and it's 6 weeks, a 6 week journal whereby the student keeps is asked the question, "How do you feel today?" Or
Hmm.
what lots of personal questions that the individual can fill in themselves, and it's just 5 or 10 minutes a day on each question. And that particular journal was so successful at Wesleyan University that the university now provides that to every incoming student um, as as a self-help assessment journal. So that's again, that particular book can be purchased for approximately $20 per book, and so the clubs can sponsor that for a particular group of children. It might be a YMCA group. It might be any, and they actually have one for school children as well as a more adult one for college and university kids.
That's great. All right. Thank you again, Alan. This.
I have a question. Quick
Oh,
question.
sorry.
Um, Hey, Alan, is this something that we could also pass out to the existing counselors to Rotaract to distribute information to Interact? Excuse me, Interact and Rotaract?
Sorry, is what?
Is this presentation or
Oh
information?
yes, absolutely.
Yeah.
Everything I've said is spread the word. Also, I'm speaking at a number. I've spoken at a number of Rotary clubs, and I've got an invitation to go down to Old Mission next in a couple of weeks' time. So I'm more than happy to expand this presentation to
Yes.
be speaking at a club, and also. Another one of our Rotarians, Dave Jones, has also got a club speaking presentation on suicide prevention.
But I mean, expanding it also to like a Rotaract or Interacts for those counselors, like especially in the Interacts, that is this information that could be spread to those? uh,
Yes, and there's a professional kit too for counselors,
Yes,
as well
so
as a family
the
kit.
answer is absolutely. It could be very relevant to interact, and it depends on the nature of. But and the like the journal would be very appropriate both to interact and to
Yeah.
rotaract.
And then one last question. With some of the things that we do within the district, like RILA, I know this subject sometimes comes up during the RILA camps
Yeah.
when it comes to students going through some very difficult times. Is this something that can be built, that could be, I believe this is something that can be built into the RILA experience for those that maybe would like to get some more information. So is this something that can be, um, you think could be built into, like, hey, here's some information for you?
Yes, I very briefly mentioned one of the toolkits is resilience at RILA, which has been specifically prepared for Rotarians at a RILA camp. And so I've sent the materials to our own district RILA team so they can consider that as part of the curriculum for the camp.
Yes. That
Yeah,
would be
because
very important.
I participated earlier this year, and it's definitely something that I would say should be offered, or at least as an option for
Yeah.
those
Yeah. Yeah.
people.
Yeah. I'll
Yes,
mention that to them when I talk to them on Thursday too.
yes, please do. Look, I sent some notes to Laura. I think Laura Shanahan,
Yeah.
and she said she was going to discuss it with the committee.
Yeah. Okay. Excellent job, Ellen. Thank you very, very much. This will go up on the website tomorrow, so that everybody can have a chance to hear you. Appreciate
Okay,
all your time.
thank you very much.
Thank
All
you,
right.
Alan.
Bye bye.
Bye.